and welcome to update number 7, Reopening the USA. It's been 4 months, or maybe 6, and the virus is with us. As you know, officially called the SARS-CoV-2 virus, and that virus causes the disease COVID-19 in humans. What are the determining factors in our being able to defeat this virus? First of all, we have to survive the disease. We can use convalescent plasma, hyperimmune globulin, or antibodies to combat the disease as treatments for the disease. Eventually, we will have a vaccine to preempt having the disease, and herd immunity, which we have talked about in other presentations. So these are some figures about how we survive the disease, and the news are good. In fact, the survival rate for those who get the infection is over 95%. So that's the good news. And even better, the young, those under 20 years of age, the survival rate is over 99%. However, in the elderly, those of us over 65 years of age, the survival goes down to 85%. Personally, I don't like those odds. That 15% gives me a lot of concern. Let's talk a little bit about convalescent plasma and hyperimmune globulin. We've talked about those in previous talks. And what happens is when a person has had the disease, has overcome that disease and has developed antibodies and other immune protections against the virus, you can take that person's whole blood, which includes red cells, white cells, antibodies, and other substances, and you can further centrifuge it and get down to packed red cells. So you have red cells and white cells in that preparation. If you further separate it, you have just the plasma. And the plasma contains antibodies. You can give that plasma to a patient who has the virus, and he will get better. It has been shown that the convalescent plasma can reduce the viral titer, the viral load in these patients. So those are two weapons that we have. And anti-SARS-2 antibodies are being developed even as we speak. And at some point, we will have those antibodies that can be given to the patient to make him better. However, the recovery rate for none of those treatments is really known. We know that they do have good effects. And as I mentioned, convalescent plasma lowers the viral load for the patient. And that is a good thing to have happened, but we don't really know, because we don't have the data as yet, it's being developed, as to the recovery rate for these patients. The antibodies that are being worked on by a number of pharmaceutical companies will be used to treat the virus as shown on this slide. The antibodies will be in the patient's blood. They'll come in contiguity with the virus, they'll attach to it, and they will either neutralize or destroy the virus. So we can't wait for those to be available. Now, very importantly, at some point we will have a vaccine. In fact, we do have a vaccine already. A vaccine has been formulated in China, and they have done some of the appropriate studies. They claim to have fair results. And when the Chinese claim only fair results, I get suspicious. So I would not like to have that vaccine, but I'm hoping, and I know that we are working in the States and in Europe on vaccines that will be very effective. And we should have those, perhaps not this year, but at the beginning of next year. And then there's also herd immunity. Now, the vaccines, like I said, are in clinical trials, US and Europe. My best guess is that they will be available, at least one, but hopefully more than one type of vaccine by January of 2021. And it's expected that these vaccines will result in the production of antibodies in 45% of those that receive the vaccine, and that will result in a reduction in hospitalizations to a level of 1% only, and that deaths will be reduced to 0.4% as compared to today's inflated numbers. Herd immunity. We've talked about herd immunity before, and that results from a person who is vulnerable, who has had no previous exposure to the virus, being surrounded by a number of other individuals that have been exposed and therefore are immune, or have been vaccinated and therefore are immune. So that person is protected by the herd around it. Now, if the herd has been immunized, then 45% of them will be immune, they will have antibodies. And the rest of the population, 55%, may not be immune, will probably not be immune, will not have antibodies, and therefore will be vulnerable. So how are we doing in terms of getting close to that? Well, we don't have a vaccine yet. So what we rely on is individuals that have had the disease and are now immune. They survived, they created antibodies, they are immune to the disease. And we know that in New York City, that approximates 20% of the population of New York City. In Los Angeles, however, where the disease has not been that widespread, it's only 4%. And as a comparison, I'm showing you Sweden, 7%, because Sweden has had a policy quite different from that of most other countries. They have not shut down, they have not locked down. And as a result of that, they have seen a higher mortality rate than most other countries. And they have also a higher prevalence of immune individuals because more of their population has gotten the virus and have become immune, but it's only 7%. So if you think that in the US we might get to 5% of the population being immune, and then to that we add the 45% that get vaccinated, we would have 50% immunity, and 50% would not have any immunity. And that is not quite good, my friends, because the minimum that's estimated that we need in order to really have herd immunity to protect those of us who are susceptible is 60%. Besides, we probably won't get all of the population to take the vaccine. We know we won't. There will be some percentage, a significant percentage, that for a variety of reasons will not want to take the vaccine. Some because they don't believe in vaccines, they have ideas that are counter to the purpose of vaccination, others because they have certain diseases and cannot get immunized. So we have a little bit of a problem there. And this ideal situation where the susceptible individual is surrounded by a herd of immune persons around him is probably not going to happen. Let's talk about reopening. When? When do we reopen? When should we reopen? Well, one way to think about it is when there's a downward trend in daily cases. And we do see that downward trend in daily cases in the US as a whole. Each of these bars is one day and how many cases were reported in the entire country that day. And as you see, the 7-day average is going down, 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 down. It's a trend that's definite. However, let's keep in mind that in the world as a whole, infections and reported cases continue to go up, and there doesn't seem to be an end at this point. There will be, but at this point, this curve just continues to go up and up. And also remember that in the US, 1 of every 10 persons tested to date has been positive for the virus. That's in the entire US, and that is a biased statistics because we have been testing mostly people almost exclusively at first, people who had symptoms, and therefore they were going to be positive. So it's certainly not going to be out 1 in 10. It's probably going to be much less than that. In fact, yesterday in San Diego, of all of the people tested yesterday in San Diego, 1 in 25 came out positive. So that is good news. And it's much better than what we're showing here, current statistics for the whole country. But remember, 20 to 40% of positives are asymptomatic. They have no symptoms. You see them, you cannot tell they have the disease. So the people you meet today at Rite Aid, at Costco, at the post office, 1 in 10 will have the virus, or perhaps 1 in 25. But be careful, because someone that you meet may have the virus and you don't even know it, because only 6% of the population has been tested for the virus. So another consideration on reopening. When to reopen? When there's a downward trend in mortality. And we look at the example that has been set by other countries. For example, Italy, they had their spike in number of deaths per day. And then that came down and down and down, a very definite trend. And they are having very few deaths on a daily basis right now. So reopening for them occurred somewhere around here, and they have done okay. There has been no spike after that. There has been no spike. The curve continues to go down. In France, they're a little bit behind Italy, but still far ahead of us. They had their spike, and then they've started to come down. It was rough at first, but they continue to come down, and they're going to be doing okay. Now let's take a look at the US. Our daily deaths peaked at around this time and have started to come down. Coming down very nicely. However, we look at California, look what's happening in California. Reached a peak and we have sort of plateaued. There might be a hint that we're coming down over here. We need to see if that's real. Now, why is this happening in California? Have we been so effective at flattening the curve that this is just the flattening the curve effect? Or is it that we were supposed to come down and haven't, because we're having this influx of people coming across the border? Most of them are US citizens who live in Mexico and have chosen to come over to the US as soon as they felt any symptoms and wanted to get treated over here. I can tell you that our hospitals in the southern part of San Diego towards the border are full. How to reopen? How do we reopen? Very carefully. Reopening doesn't mean we stop washing hands, distancing, wearing masks, or avoiding large groups. Reopening means it's even more important to continue washing hands, social distancing, wearing masks, and avoiding large groups. We are headed in the right direction, but it ain't over till it's over. Thank you.
Right, thank you, Antonio. That's really helpful information. We appreciate it. Before we go into questions and answers, I'd like to go ahead and formally close the meeting, but the Zoom will stay open, and if Antonio is willing to stay on and answer any questions, that would be great. I do want to also mention that the Community Service Committee will meet after the questions and answers. So if you're on the committee, please stay on the line and the meeting will start afterwards. And I also want to let you know that we will have our Merlot Monday again this coming Monday. We had a great start. I think we had over 20 people participate, and we look forward to doing it again. We did briefly touch on politics, and we decided we won't do that for future happy hours. We'll just drink and stay happy. So we hope that you can join us, and I'll send out the Merlot Monday invite over the weekend again. And before we do questions and answers, I wanted just to tell you one of my own medical stories. I went to the doctor recently and told him I had broken my arm in 2 places. And so he told me to stop going to those places. So with that, we will formally adjourn the meeting, but please stay on. And Antonio, if you're willing to stay on and answer questions, that would be super.
I can stay for a couple of minutes if there are questions.
Okay, thank you.
Antonio.
I have a
Antonio,
question.
this is Jim Frost.
Go, Jimmy.
Oh, go ahead.
Go,
It's
Frost.
okay, go ahead.
Oh, me?
Jim.
Oh, I don't ask many questions, but Antonio, who's ahead in the race for the vaccine? I mean, you're kind of in the know as far as who's out there, Johnson & Johnson, Pfizer, I've heard things about Regeneron. What do you know about who's in the lead? I know there's only 3 or 4 companies that really are getting the financial aid from the government, but who's in the lead?
This is not insider information, though, right? Okay.
Yeah, no.
Are you asking,
Give me any
are you
tip.
asking as an investor or are you asking as an individual?
Right, exactly.
Because it doesn't matter.
As a
The reality is that there are close to 100 or more pharmaceutical companies involved in doing vaccine research right now. Of those, about a little bit over 15 perhaps are in clinical trials already. The ones that are furthest ahead is, number 1 is CanSino in China. They have completed studies necessary for registration in China, at least. But as I said earlier in the presentation, I'm not impressed with the results because even they are not impressed with the results. They sort of say, well, this is good enough because we have nothing else. So they're really not really satisfied with what they have found with their vaccine. In Europe and the US, furthest ahead in terms of stage of clinical trials, it's probably difficult to tell the top 3 apart, but it's probably Oxford AstraZeneca, that's up there. And then Moderna is also up there in the top few. And then there's a bunch of others. And
are those RNA, DNA targeted?
most
Are
of
they RNA, DNA targeted?
most of them are mRNA vaccines. There are some exceptions like Inovio right here in San Diego, which is up there with the top 5 or 10, and they have a DNA vaccine. And there's 1 or 2 companies that have different technologies, but there's not a lot of information about exactly the technology that they're using. Most of the vaccine companies, the variation from one to another depends on the vector that they're using. Is adenovirus 5 or adenovirus 6 or whatever, but let's not get technical about that.